Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline 3 is a 30-minute conversation where we like to focus on ways to help you live a healthier, happier, and pain-free life. Joining us today to talk about weight loss and wellness and just kind of resetting for the fall and holidays are our friends with Shed It Weight Loss and Wellness on Shed Road in Bossier City. We have co-owner Irina Haskatis and physician assistant with Shed It, Catherine Schaefer. Thanks for joining us, ladies.
Yeah, excited to be back. Thank you.
Absolutely, yes. And Labor Day is kind of like that unofficial end to summer. Fall doesn't officially start for another, couple weeks, but there's always that natural shift. People going back to school, people getting back in a routine, and it seems like people are kind of focusing more inward before that crazy holiday season kicks in. Would you say that you see that at Shed It too?
Oh yes, 100%. Yeah.
Okay, yeah, so kind of like a natural shift to reset and refocus on your goals, maybe those goals that you set at the very beginning of the year. So,
I feel like a lot of patients, which includes myself, fall off the bandwagon a little bit over the summer because, you travel, you go different places, you try different foods, your routine is all messed up because your kids are out of school,
right.
And now is the time to really get back on track, back with your routine, maybe reset. I really like to call it the fall reset because you get into this mindset of change, the seasonal change is coming, finally the summer heat is coming to an end.
Yes.
So people are ready for something new, excited for something new.
Right, yeah, and I think that just even yesterday it was such a beautiful day outside, and there's like this natural excitement, I guess, of the changing of the seasons, and it's like the relief. Maybe we're probably still gonna have, like Brian mentioned, a couple of warm days in our future, but maybe not near as much as it was, in August, which is so nice. You can get outside and maybe go for a walk, and it's more motivating to do those types of things. So really quick, for people that maybe don't know who you guys are, tell us a little bit about what Shed It is and what you guys offer.
So Shed It is a weight loss clinic. We focus on GLP-1 medications, although we also have some oral options. We have been doing this since 2022, so we have about 3.5 years of experience now. We've helped several thousand people in our community lose weight and keep the weight off. And we're excited to help more people in our community.
Love it. Yes, and the GLP-1 medications have been around for a while, but if you don't know much about it, maybe you've heard it and you don't really know exactly what it's about. Some people may be apprehensive because it's a shot that you give yourself. Catherine, can you put some people at ease for what those medications are actually doing and how they really work as a tool towards weight loss?
Yeah, so the GLP is that class of medicine. Brand names are going to be like Ozempic, Mounjaro, Wegovy, Zepbound. The compounded version that we carry in the clinic is going to be your semaglutide, tirzepatide. We've recently started offering retatrutide. These are all with that GLP or glucagon-like peptide class of medication. So these are not new. They've been around a long time, used for diabetics. They work on a receptor on your pancreas, that GLP receptor that helps your body, better respond to insulin, be less resistant to insulin. The reason why they've taken off or just kind of really, become a new thing for weight loss is because they found that they also work on that hunger hormone. So they just kind of help people think about food less, have less cravings, and then they can slow that stomach and GI motility. So they help you to feel fuller sooner and longer. So if we're looking at weight loss and diet approach, and then we can take away cravings and some of the appetite, it just takes the harder part out of eating better, I feel like. And so that's why people do so well with the injections. As far as the injection itself goes, it's we have it drawn up into a little insulin syringe. It's a small little just subcutaneous needle, so it's an easy little injection. Most people do it at home, but anybody that's not comfortable is welcome to come in and we can give that to you in clinic once a week. We've got our medical assistant that'll just do a quick little wipe down, and then people are in and out before they even know they've gotten the shot. So if anybody's apprehensive about that, we're happy to help there.
For sure, yeah. And with, can you talk through the different, so we've got semaglutide, tirzepatide, and retatrutide, and who is a good candidate for those, or is it kind of sometimes trial and error to see which one works best for patients?
Yeah, sometimes it's trial and error. In general, the semaglutide is going to work on GLP-1 or just one of those GLP receptors. That tirzepatide is actually specific to 2 of those GLP receptors, so in theory maybe a little bit stronger. The retatrutide that we recently started offering actually works on 3 of those receptors. It works on GLP, it works on GIP and glucagon, the hunger hormone. So it's really kind of covering 3 bases basically. Everybody's different. I kind of think of semaglutide as like the base model, and then most or a lot of times we start there. Some people start with tirzepatide. We can always switch and try. So, if we feel like we're not getting the result we want to, or if we feel like we've plateaued with one, we can always switch and try another one and make that,
right.
conversion, or, keep going so that we continue to see progress.
And since they're, semaglutide, you're working on 1 and then 2 respectively and 3, do you see better results in tirzepatide and retatrutide because of it operating on more than one receptor?
Most of the time, yes. I would say probably 90% of the time, yes. There's always going to be an outlier or somebody that. But yeah, in general, if we feel like we've maximized our semaglutide benefit, or we're starting to plateau or not see, a lot of times we can switch and try one of the other 2, and then just kind of get that revved up and going again. So.
Interesting. Okay. Well, we've got those phone lines open. You see that right there on your screen, 318-219-4569. We'll be taking any calls and questions that you have today. And those phone lines are open, but when you do call, make sure you're in a quiet room, especially if you're tuning in on your TV, so that we can hear your question and there's not any feedback from you asking the question here on TV. That number to call is right there again on your screen, 318-219-4569. It will remain up for the remainder of our conversation. And so please give us a call if you have any questions about semaglutide, tirzepatide, retatrutide. Those are, say that 5 times fast.
Yeah.
Right? There's some complicated words, but we're here to answer any of those questions because I know that many people do have questions about these. So with the retatrutide, it's so interesting that we've advanced so much just in the last couple of years, because really semaglutide or Ozempic was created, like you said, for diabetics, and then we saw weight loss as a side effect. And now we're like, wow, you can actually really achieve some great results with these for weight loss. So talk about some of those results that you've seen in some of the patients that you've had come through the doors at Shed It.
We've had some crazy transformations, I would say.
Yeah.
Of course, you have the scale victories and the non-scale victories. So we have actually a couple of patients now that lost more than 100 pounds, which they basically half-sized. It's crazy. Like, you wouldn't even recognize them anymore. And of course, it's the aesthetics that comes with it, so they feel better, they look better, but also the non-scale victories, like not needing blood pressure medications anymore, much better sleep, which helps with overall energy. And it's just amazing and rewarding to see this and witness that.
I love that. Yeah. So I love that you said non-scale victories, because a lot of times maybe people come in with a specific weight goal. Is that something that you kind of set for them? Yeah. And then do you encourage them to also have that non-scale victory as well, so it's also equally as motivating?
Yes, because I feel it's actually more important, because you are doing this to improve your quality of life, to extend your lifespan, and the aesthetic part, of course, the cosmetic reason is the driver for most patients, but ultimately it's a side effect, because you want to get rid of the comorbidities and feel better and just be healthier overall and lower your glucose levels. So the weight loss is basically a side effect of what you should want to achieve. Yeah,
and I think that sometimes when you uncover some of those motivators, a lot of times it's like, I want more energy to hang out with my grandkids and be able to pick them up, and those are also really great motivators as well, and it's one that you'll stick to when the scale probably doesn't want to move, or it's not your best friend. Because I'm sure, do you see the frustrations with the scale with some of your patients as well?
Oh yeah, 100%.
Yeah, there's definitely, there's months where people can have a plateau, where they just don't see a weight loss like they want to. Sometimes the people are really eating well, eating good protein, exercising, it doesn't make sense. The scale's not moving at all if they're, building muscle and things, and then they realize they're a pant size down. And so, it's not just the number on the scale, even though I think that's what we associate weight loss, what number do I weigh? But there is, so many other factors into it, as far as inches, body composition, energy levels, just other things like that too, that all play into weight loss and how we feel. So
and I think that one thing I love about what you guys offer is that it's not just take the shot and don't change anything else about your life. You really do focus on the lifestyle changes, which help with those comorbidities and things as well.
Exactly.
So if you want to talk about what is your approach with the patients of making those lifestyle changes and making them stick too?
Yeah, basically anytime I see a new patient, we sit down and we talk about medical history, what medications that they're on. I ask everybody what they, do for a living, or just kind of as far as their day-to-day activity, try to get a baseline there, ask about their daily or, regular exercise patterns, and then if they've got, kind of a goal weight or size. So we always kind of have that, to build on, and then we can see as I tell so many people, it is all a snowball effect. Kind of the better we start to feel and do, and the more capable we are of moving, and the more we want to. But that's where a lot of that lifestyle comes into play. We at that first visit talk about, just general diet questions, lots, protein, fiber, kind of things that are going to make the injections work better. And then from there we have, people that we can refer to if they have more specific nutrition questions, if they have more specific, exercise needs, things like that. So, the injections really help as a tool for weight loss, but again, we can't outrun our bad habits. And so if we can really, try to do good diet, some form of exercise, everybody doesn't have to become, CrossFit or things that they're not capable of doing, but just whatever kind of exercise fits into people's life and that they enjoy, and that's what they'll stick to more likely.
Yeah, there's a lot of psychology that goes behind it, and really assessing and maybe strategizing what each patient needs, and it's very individualized at the end of the day. And I love the saying progress over perfection. And I think that showing up consistently, I think some people associate consistency with perfection sometimes, and I get it. I get why that happens, but to show up consistently doesn't mean you show up perfect, right?
No, and it's also, for a lot of people, food is also joy. That includes myself. It's the childhood memories of, for instance, the German Christmas cookies. And there is no way that I will ever shut that completely down, because that's part of life. The moderation is the key with everything. So, and that's what we try to teach our patients. If you show up 99%, this 1%, or let's say 10%, you can also eat what you really enjoy and what makes you happy.
Yeah, and I think the injections, I think you've mentioned this before, that it helps to really recognize those portion sizes.
Yes, because you get fuller faster. You can enjoy a little bit whatever is not that good for you, but then you eat a piece and then it's done, and you don't finish the entire bar of chocolate or whatever that is for you. So you have the good savory part that you want, but you don't overdo it. And this is, I think, that the big advantage of those medications.
Right. And I love that you mentioned that you're also setting them up for success, while they're on the medication. But a lot of these patients, would you say, or how many of your patients would you say want to have that exit strategy, want to eventually get off of them? Would you say that's a pretty big group of them?
I would say majority, do want to, get, down to their weight loss goals. Most people, like to maintain kind of there for a bit and just be sure that they're doing okay, and then wean down off of them. A few, obviously people that are diabetic that need it long term for, more blood sugar reasons. Some people like to stay on it. I just call it more of like a micro or a maintenance dosing. But for the majority of people, don't want to take them forever. And so that's, also where those habits really come into play, as far as being able to then wean successfully down off of the medication and then continue just with the new habits and patterns that they've created.
Yeah, and how do you feel like people? Do you have a lot of people that you've worked with in the past that did want to get off of the medications that are able to maintain their results? Yeah, great.
Oh yeah.
That's awesome. And because I think that that's a concern for a lot of people, that they're nervous that once they get off of it, that they aren't going to be able to maintain it. But you've had great success.
But also if, a couple of months in, they feel like, okay, I need a little boost. They can always come back and see us for a maintenance dose, or maybe start over again if, maybe sometimes also life changes and some stress comes into place that you cannot really do much about. So we are always here. They know how to find us. They can come back and see us, set up a consultation with Catherine and get back on track. Like it's not just because you feel like you don't see us for a month, that doesn't mean, like we get mad and you're not allowed to come back.
Yeah, no, that's so true too. So, so you know, going into the fall season, talk again about why this is maybe a good time to really, you know, start a new weight loss journey.
Yeah, I think now, as I mentioned earlier, it's this reset time, the change of seasons. I think kind of life changes, back to school, back to routine, vacation is over. It's time to focus on yourself, on myself again. And I think this brings this excitement to try something new. Also with the lower temperatures, maybe it's a good time to start a new habit like going for a walk. We like to go for a walk with the family, just for family bonding, talking about our day. We do this in the evenings now that it's not as hot anymore. It also helps, you know, not only to get some steps in, but also to enjoy the outdoors and bond with your family. So I think this is a great habit that you could start now.
Absolutely, yeah. And this is sometimes the hardest time to start in some ways because you've got just the holidays coming up. And I think that if you start now and you implement some habits early, then it feels less overwhelming in the holidays.
Right, when they're more already established habits, it'll be easier than if you were to start in December, where it just kind of feels like everything is crazy and you have a million things on your to-do list at all times. So I think if people can kind of get rooted in that and I think that's kind of where that comes from too. You know, summer, I feel like people kind of feel like they got off track if they're, you know, out of routine, on vacation, like you said, kids are home from school, and then there's like a little bit of a breather right now before, you know, November, December kicks off, and then it kind of feels like things just get, you know, just chaotic again. And so a lot of people, I think, like to use this time just to try to get everything just kind of set up for success again to go through the rest of the year.
Instead of starting over, because it's so much harder, I think, to start over, but if you start habits now, it's easier to make small changes that really do add up. And then even if you do have a couple of off days during the holidays, it's not going to totally ruin your progress.
Again, progress over perfection. We're back at it. Yeah.
Absolutely. Yeah. So with these medications, sometimes I think people maybe worry about the safety and efficacy of them, and I mean they're very much regulated. I know that there are some side effects. If maybe you want to talk about some of those to expect going into it, and that's something that of course you all already talk about in those sessions too.
Yeah. So anytime somebody gets started on the injections, we talk about that. It can slow that stomach and GI motility. Things can just be slower to move through your GI tract. The medical term for that is like delayed gastric emptying. But basically things are just slower to move through so they can help you feel fuller. Because of that, people can get, you know, just GI or stomach side effects. People can get some nausea, people can get some heartburn, changes with bowel habits. I would say more often people get constipation. Some people can get some diarrhea. You know, more extreme would be like nausea, severe vomiting, you know, type things. Anyone that we start on the injections, we start at a low dose just to be sure that we're tolerating it well, and then we're always, you know, pretty conservative with how much of that dose that we increase. We don't want to start too high of medicine or give anything that would be unsafe. We also talk about tips as far as like drinking good water, doing good fiber, things like that, just to keep your GI system moving and happy to try to avoid any of those side effects. And then what to do if we are having some, you know, some people unfortunately might have a little side effect even if they're doing everything right. And so then, you know, there's ways to walk through that or troubleshoot that as well. So, you know, scary side effects, you know, potentially, yes, can happen. We've had very few or minimal, just kind of being able to talk through with people and, you know, just be sure they're educated on their dose and how to do it and, you know, what to eat, what to avoid. There are certain foods that you can eat that are going to make you feel bad. And so, you know, if they can be aware of that before they go into it, then they can just avoid struggling with some of those side effects.
Yeah, that's so true. And you kind of screen a lot of the patients as well if there's any potential adverse complications because of previous diagnosis. I mean, I'm sure, like obviously pregnancy, you can't be on these when you're pregnant. What are some of those other things that you screen for to where you're like, you can't really be a candidate for something like this?
Yeah, I ask everyone if they have a history of medullary thyroid cancer, then or a family history of medullary thyroid cancer. Multiple endocrine neoplasia syndrome type 2 is another specific. You know, if you or someone in your family has had that, then we are, you know, are excluded from these GLPs. You know, I ask people if they've had history of pancreatitis. Sometimes pancreatitis was caused by other reasons, so that's not an absolute can't take it for that reason. But I always like to ask people just to know. You know, like you said, again, pregnancy, things like that. So there are reasons why people can't take it. There's not a ton. For the most part, people do benefit, but again, we always go through kind of that list of reasons why people would not be a candidate for them.
Right.
Yeah, safety first, 100%.
Yes, absolutely. So if somebody is interested, but they're still on the fence of taking these medications and maybe they just aren't ready yet, that still means that they could maybe come and have a consultation with you guys, because you don't only just offer the GLP-1s. There's also other things that maybe they could do to get kickstarted and then maybe reconsider the GLP-1s when they're ready.
Yes. We do offer oral options as well. There's a lot of people that are not comfortable with injections, although, as Catherine mentioned, it's this itty bitty tiny needle. Even I can tolerate that, and I really hate needles. But even people that are not really interested in weight loss or feel like they don't need it, but they would like to know their body composition, like the muscle to fat ratio, they can come in and do our body scanner. For non-patients, it's $40, but it gives you really a plethora of information. It measures like your thighs, your waist, your hips, your arms, your neck. Gives you, as I said, the muscle to fat ratio, of course, the correct weight. And I think it's just a great tool to understand what your body composition is, because as we said earlier, it's not just the number of the scale, it's really what you're made of.
Yeah.
Are you made of fat or are you made of muscle? And that makes a huge difference.
For sure. Yeah, and that's a big thing that you guys also monitor as well, because I mean, it's, if you're losing weight, that's only really half the story. You want to make sure you're losing the fat, you know, and not muscle.
Correct.
If you want to talk about why that's important, you know, why to maintain the muscle mass versus the fat mass and how that impacts your metabolism.
Yeah, just your muscle mass is going to have so much to do with metabolism. Any bit of muscle that you have on you is going to burn more at rest, so that potentially means you can eat more. That just kind of sets that higher threshold of just what you're going to burn during the day, basically. So then if we have people, you know, that have gone into this calorie deficit because of the GLP, but they've lost a bunch of muscle mass, and that actually resets just how much you can eat total, you know, to a lower value. And sometimes that becomes hard, because then if we start to eat over that number, then we see weight gain, you know, even if we haven't changed a whole lot else about our diet. So that's why just the more muscle we have on us is important. We certainly don't want to lose that. Muscle becomes harder to put on even just as we age, and hormones and things. And so muscle is definitely something to be proud of. We don't want to lose it. So we talk about, you know, trying to eat good protein, how to keep our bodies moving, resistance training, just kind of stuff like that that's going to help keep muscle or build muscle even, but not lose it.
Right. Yeah. And I think another perspective too is that you can't, I mean, it's harder to gain muscle when you're in a calorie deficit, eating less calories than what you're burning. And so that's, to your point, the protein's so important, but also, like, we're not meant to be in a calorie deficit for the rest of our life.
Yeah.
You know, and so it's okay to be in that cyclical where you are, you know, in maintenance for a little while, and then in a deficit to reach your goals. And so that's very healthy for your body to not be in that period of like controlled starvation for so long. So I think that's a perspective that diet culture does not preach, you know, and so it's just kind of taking care of your metabolism. So it's really important to see that whole picture instead of just lose weight, and then ultimately, once you get off those medications, if you're not prioritizing the things like you guys help your patients do, then you could be in a really bad spot.
Yeah.
You know, to where you're off the medications and then you just gain it right back. You know?
Exactly. And we don't want that for sure.
Yeah. Okay. So you guys also offer the Gallery testing. And this is something that is great for people that are interested. I mean, there's so many, you know, it's a cancer screening tool, and there's so many instances of cancer nowadays. So tell us a little bit about that.
Yeah. So one risk factor of cancer is actually obesity. I'm not sure if it was 10% or 20%. My husband would know exactly, but he's not here right now. But it's a big percentage. So the Gallery multi-cancer test is an early detection test. It's a blood test. And when there is cancer, it would shed DNA into your blood. So this is how you could find those cancer cells before maybe you even have symptoms. And of course, with cancer, we know the earlier you find it and treat it, the better your chances of the outcome are. So this is why we offer the Gallery test. Unfortunately, it is not covered by insurance as of right now. It's $949 self-pay. And of course, it's only, like it gives you the status quo of this moment. That doesn't mean, in 3 months from now it cannot change. So they usually recommend to do this test every 12 months, specifically for people after 50 because the occurrence goes up, or earlier if there's a family history. For instance, I have breast cancer in my family, so I started doing this actually when I was 40. I think I did it for the first time 2 years ago.
Nice. Okay. Well, we have our first caller, Juanita. I want to get to that. Thanks for joining us, and what's your question?
I'm profusely sweating, and I don't know why.
So
dripping.
We are talking specifically about weight loss today on the Healthline. So if you did have any other concerns, maybe unrelated to this, you might want to reach out to your primary care provider, or if you are really concerned about it, maybe take a trip to the emergency room. So, but thanks for calling. Again, we are talking specifically about weight loss and weight loss injections today. But yeah, going back to weight loss injections, so we just have a couple minutes left. One of the really cool things about GLP-1s that maybe people don't realize, and what's coming out in the research and the literature, is all these benefits as far as, like, not even related to weight loss, decrease in inflammation and other, chronic disease. If you want to talk about what you've seen, Catherine.
Yeah, I mean, they're really showing, like you said, inflammation, plaque as far as like coronary disease. Tons of people that we see even that have, arthritis or some rheumatoid conditions, just say overall they feel better, their joints feel better. Some of it obviously is with, weight loss, our joints feel better. But I think just in general, that inflammation, just kind of that layer of that has really, really been targeted with the GLPs. So I'm curious to see kind of just the more that they study and, the more conditions that they do, we'll see benefit from. They've seen liver conditions, become better as far as like fatty liver, things like that. People, cholesterol levels have come down, blood pressure comes down. Some of that too is weight loss related. But again, just really interesting to see kind of other things besides just, diabetes, which they were started for, and then now, obesity, which they've, really targeted, but other conditions that really become better or more, beneficial just from using the GLPs.
Addiction.
Yeah.
Very interesting. Yeah, because even think about food. Like, food can sometimes be in that be a very addictive substance.
100% sugar.
Sure. Yeah.
1,000. I actually read in a book that sugar is more addictive than heroin.
Yeah.
And I believe it, because once you have this craving, you have to satisfy it.
And a lot of your patients report to the decrease in the food noise, because you just think about food, I think hunger, like when you have that physiological response to needing to eat, but, or you're going to starve. But there are, I think, some instances where, when you think about a baby, they're like, they tell you when they're hungry and they stop eating when they're full. And I think that we have those hunger cues that are natural and innate in our body. But I think somewhere along the line it gets just
skewed.
It's kind of skewed, and that's all you think about sometimes if you have that addiction to sugar or processed foods. We just have
food so available and processed food so available that we certainly don't live like our ancestors, or kind of before, whenever hunger cue was really what drove you, or you starved. Now we just have so many options, so many things, and the more that we reach for the bad stuff, and the more we want the bad stuff, and it really is just a cycle of that.
Yeah, I'd be interested to see if it has any relationship to repairing gut issues. Like
the microbiome, you mean?
Yeah, microbiome, because it's so related. Our gut and our brain are so connected.
Yeah.
That's one thing that I would like to see coming down the line, if it helps with, irritable bowel syndrome and other gut issues that people have.
I could actually see that.
Yeah.
I mean, obviously I'm not a doctor, but I think it would help.
For sure, yes. Well, we just have a minute left, and we're just kind of getting into some more interesting conversation. But where can people find you if they're interested in learning more about Shed It?
So they can look at our website, which is shedit.com. We also have a lot of content on social media, on TikTok, on Facebook, and on Instagram. It's Shed It on Shed Road. On TikTok, it's Shedit318. They can also call us at 318-746-3880, or just email us at info@shedit.com. Or just visit us at the clinic in Bossier, 2211 Shed Road, Suite B.
Yes, so easy. Shed It on Shed Road. Shed It meaning you're all about helping people, find their happy weight and lose weight and feel better. So, thanks guys for joining us. This will be on our website. That's ktbs.com. /podcast.